and I'm here. How bad is it?
I don't feel anything.
Alright, Dr. Emer, we're live.
Hey guys, it's Dr. Emer, and we're here on our final day in Manhattan. We're doing a lovely patient here today. I'm very excited because this is her first ablative laser for scarring and texture, just anti-aging. She's younger with lighter skin tone, which makes this a lot more amenable to laser treatment, and actually for her to go a little bit stronger, which is what I'm doing right now with my Halo. Halo is one of my favorite lasers for scarring because it's a hybrid fractional laser. You can see that here. What does that mean? That means that two wavelengths of laser are firing at the same time. And not until recently was this the only one that's actually on the market, firing both superficial and deep. Hold on, let me show them. When we do our passes, the superficial layers, a lot of those scarring superficial layers of skin come off, so we have to wipe that off as we go through treatment. And she actually did a long topical numbing plus a little bit of nerve blocks, and she's feeling basically nothing, which is amazing. Some people's tolerance is a lot better. We did do some nerve blocks though, because I always like to make it.
Would you be in LA in June? I want you to book an appointment. Yes, we'll be there in June.
We will be there, guys.
We'll be there tomorrow.
Tell them to do a virtual with us first, so we can plan it.
Send us a DM, full name, email, and phone number. You also have to connect you down on brown skin. Yes, it can. We've done it many times.
I just did it right before this on an Indian client. So it all.
Dr. Emer, I'm only here to hear your sexy voice.
Oh, well, thank you. Hey, guys. I heard that that's pretty sexy. Is it? I don't know.
When is the next time you'll be in July? You guys will be back here in July.
You have the dates, don't you?
I do. I just posted them.
Excellent. So they're on our stories.
There are stories on Jason MD.
So if you guys look at her skin, a lot of the superficial part of her skin texture is going to improve pretty quickly because of the halo, which is creating all these little dots. All the little clipping and poking noise, that popping noise that you hear, that's the erbium part basically healing the skin. It's going to create little holes in the skin.
People want to know what's the full price for this treatment. Send us a DM, full name, email, and phone number. It depends on the combination that we're using.
And the deeper component is the infrared, the 1470. That part you can't see, but that's going to improve over the course of 2 to 6 months, which is why I always tell people with lasers, you look great initially, it peels. Then the skin starts to do funny things. In lighter skin tone, it typically is actually fine. In darker skin tones, it turns a little hyperpigmented, which is why we prep the skin. And immediately after you peel, we have people use my Emeragecosmetics.com skin protocols. One of them being retinol and hydroquinone. Obviously, my AOC and my Hyla B for very important for healing, as well as anti-age serum. Perfect. So now we're going to go under her cheeks. So this is where I want you to grab me the marking pen. This is where what I'm going to do is I'm going to mark really quickly some of the scarring around her mouth and on her cheek area. You don't have a purple? Well, it's okay. Take your time. So if you guys see, she has some ice pick and rolling scars here and also here. Yes, we could do TCA and things like that, but I want to see what the laser does. So we're going to focus much stronger here. We're going to focus much stronger with the CO2 in this region right here. Okay. And then we're going to feather into the rest. But I'm at least marking some of those deeper scars. All right. So now we're going to go turn. I'm going to turn your head a little bit more to the right. There you go. Perfect. 90 degrees we can. How is the pain over here now?
I don't feel anything.
She doesn't feel anything. It's really amazing. I really feel like my New York clients are the strongest. I don't know what it is. I don't know, but that's great. I did my residency here in Mount Sinai. You guys know we had actually a couple Mount Sinai clients this week coming to see me because I went there. It was really cool. She's doing really good and feeling very little with the nerve blocks. So the goal will be a lot of these ice picks and rolling scars that are more, and box scar that are more superficial, very difficult to treat with without doing a laser combination. And so by doing this laser combination, we're getting the superficial layer and the deep layers. It's going to improve her much more rapidly. What are they saying there? We have SCITON Josh on yet or no?
No, it's sad, we don't.
My God. Do you have her before you can show them?
I actually do, yes.
That would be great. And
Before photo.
you guys can see from side lighting, a lot of those that irregular texture, which I know is what bothers her. So the goal would be remodel, remodel, remodel. It's gonna take me 2 or 3 bigger lasers in the next 6 months. And then from there, maintenance, you know, and then having her literally right when she peels, I want retinol, hydroquinone. I want her to continue hyaluronic acid like my Hyla B, vitamin C while she's healing, our AOC, refit peptides for my Emerage Skin, anti-age serum as a stem cell product, and enzymatic polish for cleansing with Cleanzyme. Yeah, go ahead.
One of the doctors wants to know, is pre-treatment needed?
On her skin tone, it's not as important, although I do feel like retinol, vitamin C, hyaluronic acid, and any botanical anti-inflammatory. Currently, we use SkinCeutical Phyto Plus, but mine, AOX Phytoprotective is coming out very soon. You guys will have that in the next about 1 to 2 months. It's amazing.
I actually have people asking, what treatments are suitable for darker skin tones? This is suitable.
It is. You can actually
If you come to
consult.
us, if you go to someone else, maybe not.
Tell them to consult.
You guys send us a DM, full name, email, phone number.
You really need to see your skin. Like I customized my previous client before her is an Indian client, did the same treatment, totally different setting, totally different. Cannot do the same. But if you were to go into the sun, regardless of whatever skin type you are, it's not going to be good. And that is why if you're doing lasers like this, you really need to be, she doesn't look like she sits in the sun at all, which is great. She's got more porcelain glass-lace skin, but if you do, it can be a problem. It can cause severe hyperpigmentation, redness, prolonged erythema, and things like that. So best not to do that. Oh, thanks, babe. So we're just gonna continue. And when we do the halo with the CO2, go a little bit lighter on the halo, because we're gonna be doing the CO2 on top.
Got people shouting out Rosa, they know she's here.
Hi guys.
A little bit. Rosa is gonna be going, I'm gonna turn you the opposite side now. Rosa is gonna be going to nursing school soon, you guys. And then what does that mean? Very soon, she's gonna be offering treatments in the office as a laser nurse. All right, and you guys can see here, grab me the marking pen again. So again, this is the area I know that's gonna be bothering her, is this sort of irregular texture through here that you can see, especially on the side lighting through here. There's a little bit even around the mouth, right through here. So we want to make sure with those, we're definitely going, you know, stronger. Doing phenomenal. Even with the little nerve blocks we did, minimal pain. And so this is one of my favorite combinations now. As a maintenance treatment, if she wanted more than just a halo, we can add profractional laser, or we can even do one-time contour just on the central cheek. We can contour the middle part. She would be red though for probably 4 to 6 weeks in that area, but the results would be quite phenomenal, be even more aggressive than a CO2 combo. We would just have to see how she does. I'd rather her not have that, which is why it's better to do this initially. I just think in the old days, we used to do that all the time. And patients didn't really care, but nowadays everyone kind of wants to get back to it, to their work, you know? So yes, lasers are more geared towards lighter skin tones, but again, darker skin tones can be treated with the right combination. What else are they saying? How are you now on pain?
I feel great.
Love it. perfection. Were you nervous? Because I know you have never done this before.
A little, but honestly, like, I trust you.
Thank you. That's a lot. That means a lot. No, it's great. That makes me happy. I've been doing this a very long time. I remember when we first started doing this, I was practicing on my best friend. That's how I learned. And we didn't do nerve blocks, and we didn't do any of that stuff with strong settings, and even the numbing cream. It took me about, what, 2-3 years to develop this numbing cream, which is quite substantial and amazing.
Yeah.
Did not go as well, let me tell you. People grabbing onto the beds when we were doing the lasers. But now we get it to a point where it's like you. Most of the patients, I would say, are very, very comfortable. I do actually, and we prescribe that, and we do it topically. Topical TXA is phenomenal. It's in the anti-age serum that we love. So the anti-age brightener that we love, which is a serum. So you'd want to add that into your prep, which would be our AOXY Phyto Plus Hyla B and Refit with the brightener. On her, she's lighter skin tone, it's not as important. If you're a Hispanic, mixed ethnicity, African American, Indian, Middle Eastern, that wouldn't be a bad idea.
Someone just got on, they want to know what they're looking at. You guys are looking at our ACNE Star combination treatment. Right now we are doing it on Halo lasers, a hybrid fractal laser from SCITON. And now we're giving her skin a resurfacing, doing a 2 wavelength right over the skin. Every time you do that pop, there's a little spot being created on the skin. See it right there.
Almost done with this pass, last pass. No, we have to set it up. We have to, I wouldn't. And you should have it separate because remember it's for SCITON. Alright, you guys, so we're finished Halo. We're going to do her nose really quick. What I want you to know is take a look at the forehead here. Look at that cheese grater type of look. Look at all those little holes. That is the erbium. It's basically remodeling the surface of the skin. That's a really good response. Show them really up close there, all those little dots. Yeah, take a look at that, you guys. That is going to peel and help improve the texture of her skin, which is why you have to do this in a series of treatments. And also, it's why now going into the CO2, we're going to see a better result. Because a lot of the surface cells are gone. In the old days, we used to do, let's say, a 50 or 100 micron pass, erbium, like a contour, full cheek, one pass. But then we would go over it with the CO2, or vice versa. And you would see an even better result than doing one or the other alone. I'm gonna keep moving you, I'm sorry. Keep pushing you.
You're fine.
Okay, good. So why don't you think I'm pushing you around here? You gotta get all sides of the nose.
No, you're fine.
You're doing really well. We did actually a dorsal nasal nerve block. So you don't feel that much on the nose. And we have amazing goggles protecting her eyes. Those are our innovative optic goggles. You guys should see my Instagram on there. Jason Emer MD. Yeah, if you want to continue, you can. I don't think it's good. I wouldn't. Hold on. Alright. So that's Halo, you guys. We're going to get ready and start her CO2. She's doing so well, I'm not going to renumb or anything. We're just going to go right into it. So stay tuned for the second part of our acne scar protocol. Alright, lift this just a little so you're a little relaxed on your eye. There we go.
Okay, so right now we're just changing over. We're grabbing our CO2.
Top of the next one. Yeah, because